Good evening, Los Angeles. 8 months ago, yesterday, 8 months ago, on March 15th, I first came to this podium to talk to our beloved city. I spoke to you for the first time about the arrival of a novel coronavirus on our shores and in our city. And I told you that we would have to marshal all the resources of this incredible place called Los Angeles, all of our resources, all of our resolve, that we would fundamentally probably alter how we lived for some time in order to avoid tragic and devastating outcomes at the hands of this pandemic. Since then, 249 days have passed, and we have been through one ringer of a year. I've talked to you, counting tonight, 75 times, sharing tough truths, heartbreaking stories, and heartwarming actions of everyday Angelenos. We have lived through so much in 2020. While so much still remains foggy, looking back on this year, one thing as your mayor to me is very clear. I take a great deal of pride in what you have done, what we have done, to rise to the challenge, to change our behavior, to change our city so that we could save thousands of lives of the people we love most. Thank you. Thank you for everything you have done. On March 15th, we became the first city in the nation to shut down nightclubs, bars, gyms, bowling alleys, and other places where people gather. And that wasn't our last first. We consistently stepped out and we consistently stepped forward. In the face of confusion and indecision elsewhere, we took educated risks and we tried whatever it took, and it paid off. We were the first big city in America to have a moratorium on evictions so that people could stay in their homes as we asked them to stay at home. We were the first big city to mandate masks, to offer testing widespread to people with or without symptoms. We provided 5 million meals to seniors, over $150 million of direct assistance to our most vulnerable, including immigrants who had been written out from Washington of direct aid. We helped people, everyday Angelenos, through your donations, through our corporate donations, our nonprofit help, to make sure people could stay in their homes, pay their bills, and feed their families. And we changed how we lived. We pulled together by staying apart. And I know what a toll that took on us, what it takes on us still today, to not hold our loved ones, to not see a parent or a grandparent. But we were able to flatten the COVID-19 curve and avert a worst-case scenario. It wasn't easy, and it has taken its toll on everyone. There were surges this summer, but we redoubled our efforts and got smarter about keeping the virus from spreading and keeping our economy going. But these battles, these days, and yes, these losses have taken their toll. I know how exhausted you are right now. But we have done what we had to do, and Los Angeles has never experienced the kind of surge that we've seen in other cities around this country and even throughout the world. Now autumn has come, and winter is almost upon us, and this virus is now spreading at an unprecedented rate across our country and across the world. This is game day. This is the moment. We will define whether this virus takes more, too much more from us, or whether we step up to protect that which we love the most. The United States is now breaking new infection records every single day. Hospital wards across the country are filling up, and in some places are at capacity. And as of today, an American is dying from COVID-19 every minute. Every minute. These are the mothers and daughters and grandfathers and sons. These are our loved ones in this country. And here in California, while we're a little bit better, we're seeing the same widespread virus transmission. And today, Governor Newsom announced that counties that comprise 94% of this state's population will move back to the most restrictive tier, purple. I so wish that I were here tonight with a message of comfort and only of good news. And we've certainly seen some rays of light even as these heavy clouds are overhead, especially not with just one, but two announcements of successful trials with vaccines. We're working very hard with the county and the state and even our national agencies to make sure we are well prepared to distribute this vaccine to our communities, but a vaccinated city is still months away. So tonight instead, I'm here with the strongest message of warning. The risk of this disease has never been higher, and the accelerating pace of infections has never been swifter. Infections are up, hospitals are fuller. This virus is causing more people in more places more rapidly to get sick than any time since the earliest days of this crisis. Los Angeles is in a very dangerous situation. The alarm bells are ringing, and now is the time when I want you to feel the power that you have, the time that we can turn this surge around. We have done this, Angelenos, and we will do it again. And if we don't change our behavior, we know what we will see: more deaths, more financial hardship, and more suffering. Since LA is now home to the world champion Los Angeles Dodgers, let me put this in a baseball metaphor. We're somewhere maybe around the bottom of the fifth or the bottom of the sixth, and we're on the field, and the bases are filling up, and we have to defend the lead that we have and defend the field that is ours if we are going to make it through with a victory. It's always the toughest time when you're at that halfway or just past halfway mark, when you don't know what you have left in your reserves, when you've done everything you can and you think you don't have anything left in the tank. But as the Dodgers showed us, as the Lakers showed us, as Angelenos have showed us throughout this, I know that we can and will get through these days. We want to get to a vaccine without having to shut down the economy anymore. And we want to get to the vaccine without experiencing a massive loss of life. That is our collective goal. So tonight, I'm calling on every Angeleno to step up and to take action to stop the spread of this virus. I told you that one thing you could be rest assured of: we would never stop working for you during this virus, and we haven't. From providing tests to paying rent, from equipping our hospitals to feeding vulnerable seniors, we're going to keep doing everything we can inside your city governments and your county government to make sure you are safe and that we protect our livelihoods and economy. But we all must up our game in these days, and we all have a role to play, not as passive bystanders, but as active participants and lifesavers. So let me begin with new guidelines for travel. Governor Newsom on Friday announced a travel advisory and asked us all to cancel all out-of-state travel and to stay local. If you are traveling back into California or welcoming guests, the state asks you and all visitors arriving in our state to self-quarantine for 14 days. But let me be even clearer. If you don't have essential travel, don't travel. If you don't have to take a trip as an essential worker or because of a family emergency, don't travel. And if you do have to travel, you will have to quarantine. Not for a day or two, not for a positive test or two, for 14 days. That's the guidance right now from our public health at the national level and local level. Later, I'll share with you what we're going to do to help those who absolutely have to travel be even safer. Second, let me update you on enforcement. The City of Los Angeles will ramp up our enforcement of the county's current public health rules. I have directed our city departments to expand enforcement efforts for businesses that are still not in compliance with our public health protocols, and we will issue citations under the Administrative Citation Enforcement Program and revoke permits for businesses who violate our requirements and put all of us at risk. I want you to understand how serious this moment is and what has led us to take these extraordinary steps. I shared with you the national and state numbers, but now let me share our numbers here. In LA County, we've seen cases double since last month. In fact, if we took this Saturday's statistic, that's just one day, they've tripled. And we're seeing the highest daily case numbers since the middle of July. Today in our county, we had 2,795 new infections, 1,245 here in the city of LA. The transmission rate is up. We've passed that 1 threshold, and we now believe it to be at 1.03, meaning each person who's infected is infecting more than one person. Hospitalizations are up. In our general emergency hospitals, 1,126 people are hospitalized for COVID-19. Remember when we just had about 700? This is a 7.3% increase just since yesterday, to give you a sense of the pace of this. Across the county, there are just 557 available beds, including 451 acute care beds and 106 ICU beds. 106 ICU beds available, but we have 308 ICU patients as of today who are severely sick, a staggering increase since last month when just 170 people were in those beds. And while the county reported 6 new deaths today, and every death is always a tragedy, and more accurately, not a statistic but a person, a beloved Angelino to be mourned. This statistic we know is a lagging indicator, and we know these numbers will most likely rise and rise dramatically in the weeks ahead. The situation in LA is more concerning than it's ever been. I don't say this to scare you. I don't say this to try to spin the numbers. It is just the truth that right now is the toughest moment we have faced. And we're entering an even more dangerous time. We have no reason to believe that a worst-case scenario can't happen here in our city and county. In other words, just because we've done so well doesn't make us immune. From the worst images we see, people who are dying in the hallways of hospitals in Italy, what we saw in New York with trailers for bodies outside of hospitals that ran out of space. So I want to be frank and I want to be sober about where we stand with this virus. In the short term, over the next 3 months, the only thing standing up between this city and a worst-case outcome is us. So here's what we can do right now. First, we must stay at home as much as possible for the next 2 to 3 weeks, except for accessing essential services, food, and outdoor exercise. This is a good time to FaceTime with loved ones, make a dent in your Netflix queue, and to put off social plans altogether. This simple action will help bring Los Angeles back from the brink. Use delivery services instead of going to the store if you can to protect our workers. Before you leave your house, ask yourself whether this outing is essential, and if it isn't, for these next few weeks, return to just staying at home. Second, remember early on when we assumed people we hadn't seen in a long time and strangers were infectious? We need to get back to that and assume that everyone you encounter outside your household is infectious, everyone. Don't take shortcuts. Don't assume just because it's somebody that you know or you've talked to frequently on the phone that you're going to be okay if you get together personally. Our motto is clear. Don't share your air. This is how the virus spreads, when we share our air. And the 3 C's, remember those? Crowds, confined spaces, and close contact are all extremely risky. If you're dining outdoors, it's not an excuse not to wear your mask for 2 hours. Put it back on when you're not eating or drinking. Keep your distance, and right now, wear a mask anytime you're out of your home. We all still see too many people not wearing masks when the science is well settled, and we know that thousands of lives, it is our greatest weapon to save lives. Third, stop gathering. County Public Health is determined. People always ask me, Mayor, what is the source of this? What stores? What industry? It's really the gatherings that are happening on a social basis, casually. Maybe you got together with friends to watch the game and it was more than 3 households, or you decided to go inside and open up the windows in violation of public health directives. We cannot afford to have gatherings be the spread that we see. It's not just what's open and closed, it's where we go and what we do. So don't do stupid things and don't do risky things. Our economy and our lives depend on your good judgment. It's important to understand why gatherings are so dangerous right now, so I just want to spend a second there. The same pattern has emerged with other respiratory pathogens, like 1918 influenza and the 2009 swine flu pandemics. The virus spreads most rapidly in the fall and the winter, partially because there's colder and drier air. And more people are moving their activities indoors where there's no natural circulation, no direct sunlight, and viruses love these settings. So viruses can't wait often for the fall and the winter to thrive. And that's why we've long stressed that outdoor activities are safer and indoor crowding and gatherings create great risks. And our bodies are also more likely to retain virus in winter because fluids in our body become thicker, making it easier for the virus to stick to your cells when the virus enters our airways, causing us to get infected. So here's the bottom line. If you're getting together with others inside your home or at a friend's house, you need to stop. And any gatherings must include no more than 3 households for no more than 2 hours outdoors with every person socially distanced and wearing a mask. And you know what's better than 3 households? 2. And you know what's better than 2? 1. So if you can see these folks virtually, put it off. You might just save someone's life. I know it is too painful for us to remember some of this risk and to think about the loss around us. And for families like mine who have lost somebody, it is something that we carry with us every single day. There are simply too many heartbreaking cautionary tales, like this August, a couple in Maine who said, we'll just have a small wedding with only close family and friends. That intimate gathering of just a few people became a deadly super spreader event, ultimately resulting in 175 people being infected and tragically causing at least 7 Americans to die. That can happen here. It's not that we're going to have 175 people around us, but if we're all cutting corners, gathering with a handful suddenly becomes 25, becomes 125, and it spreads quickly with just 1 or 2 people removed from those that we spend time with. I know that this is inconvenient, but for the medical professional who's been working back-to-back shifts, who's not seen 1 or 2 or 3 waves, but only 1 ongoing wave for 8 months, for the cashier who's bagging your groceries, and she's still now frightened as cases surge about her family, for the person you will never meet but who is those 2 or 3 people removed from you that you could infect and who will suffer greatly and die as a result, this small sacrifice will mean everything. Thanksgiving is not an excuse to break this rule. The CDC has updated guidance for the holiday, urging all Americans to celebrate virtually or with members just of your own household. This is what you need to do this year. Don't travel to visit family in other cities or host others from out of town or other households if possible. For Thanksgiving, please don't eat or gather indoors with people who don't live in your home. And if you have plans to celebrate the holiday with others who are not in your household, you must do so outdoors and safely distanced and not go over those 2 hours. Everybody needs to wear a mask when they're not eating. And if you need any evidence of what's at stake, just look to our neighbors in Canada, where there's generally been much less spread. But they celebrate their Thanksgiving, as we know, a month earlier than us. And health data from the Canadian province of Alberta shows that their Thanksgiving on October 12th led to huge spikes in infections in the cities of Calgary and Edmonton and throughout the province. So here in the US, let's show our gratitude by staying safe and staying apart and being thankful for the living among us. Take the precautions to ensure the people we love are still here to gather next Thanksgiving when we can once again be together. Finally, I want to focus on one other critical action you can take to keep yourself and your city safe, which is to know your COVID-19 status. As I've said before, tests aren't a passport to party, and they aren't a passport to travel on unneeded travel. But tonight, I'd like to announce a dramatic expansion of our testing program to respond to this moment and its danger. The surging demand that can help you and your family stay safe this winter. Over the coming week, first, we're going to be expanding our mobile testing program by 2/3, from 3 to 5 units, each of which tests 200 to 500 people a day, continuing to serve the highest need areas of our city, not waiting for them to come to us, but coming to them. And second, we're going to bring testing to the airport. Again, this is not something to encourage you to suddenly travel on planes, only if it's essential or an emergency. But at LAX, we will be offering PCR tests with the results within 24 hours at Tom Bradley International Terminal and Terminals 2 and 6 beginning early this week. This is the first step towards the full testing facility and lab that will open there during the first week of December, providing multiple testing options, including rapid testing and PCR and antigen tests for passengers and employees. To be clear, don't travel unless you must. But we are closely following data throughout this emergency, making sure we know where people are getting infected and how we can surge resources to those areas. I'm proud we were the first big city in America to appoint a chief equity officer to look at how this disproportionately was impacting communities of color, low-income communities, immigrant communities, and others. Just as our successful strategies helped us be one of the few cities in America to bring African American deaths down to under the proportion of the African American population in general, by taking tests to communities that were overlooked and underserved, we're going to use that same methodology and continue to throughout this crisis. And today, data shows that infection rates are spiking, especially at especially dangerous levels in the Northeast San Fernando Valley, with 9 of the 10 neighborhoods with the highest increases in recent weeks located there. So today we're going to be taking action. Monday, November 23rd, we will open a super walk-up site in the Northeast Valley. The location is still being worked on, but we will have it open by then, to provide approximately 3,000 additional daily COVID and flu tests, flu shots, and rapid antigen testing for people with symptoms, to serve the communities of San Fernando, the city of San Fernando, the communities of Pacoima, Sunland, Tujunga, and Silmar. At city sites this week, we've also dramatically increased from just what was about 23,000 tests a couple weeks ago of capacity to 34,000 people we can test each day. And thank you to so many Angelenos who took that text that we sent to you seriously and got your test done. And as always, testing appointments are available 7 days a week for anyone with or without symptoms. And let me thank again our incredible partners at CORE who have been doing an extraordinary job volunteering to staff those sites, along our brave men and women of the Los Angeles Fire Department, as well as everybody working in the county and other testing centers throughout LA. To find one of the more than 100 testing locations, please visit coronavirus.lacity.org/testing, or just call us at 311. And if you think you might have been exposed, get tested immediately and quarantine. I think some people have slipped on that. Get tested and quarantine until you've received a negative result. But remember, your test result is just a snapshot of your status the moment you took the test, and you can still manifest the virus even if it didn't show up. I've been so proud of you, of what Angelenos have done to protect one another, to avert a massive outbreak. As I said, the first to shut things down, the first with masks, the first to eliminate the disparity of deaths for Black Americans. But this is a different kind of moment, a new level of danger. And if we don't make these decisions now, there really is only one outcome. We will almost certainly have to shut things down again, and more people will get sick and die. We've seen and felt too much loss here in Los Angeles. We've endured way too much grief, and we've said goodbye to too many of our beloved to not finish this fight strong. When those people that we loved fell ill, they were raising children, they were building careers, they had dreams left. Whether they were retired or whether they were younger, they were pursuing their passions, they were our neighbors, they were us. And when they died, they were alone, and they were isolated. They were forced away from the people they loved in the moments they needed them most. I know it hurts to remember that, and it hurts to think about that. But we have to remember that now, every day. This tragedy is global, but it's felt so local. It's felt in households and work sites, in neighborhoods and communities. And it's our shared responsibility, each and every one of us, to help move our city from grief to grace, from suffering to strength, and to call on the memory of those who have passed on, to summon the very best of our Angeleno spirit to lead with love and with our smarts and with our guts in the service of our highest value, which is protecting human life. That is our mission, one that we will look back on years and decades from now and tell our children and our grandchildren about how Los Angeles survived its toughest fight, its greatest challenge, and we did it together. So take this seriously and follow the rules and let's beat back this virus once and for all. And stay safe and stay healthy, and please stay at home. Strength and love to you, Los Angeles. With that, I'm happy to answer questions, and then I'll come back as usual to also speak in Spanish. Thank you. I'll take the first question.
First question.
The first question is from Steve Gregory of KFI News. Please go ahead.
Hey, Steve.
Mayor, good evening. I have a few questions here
Sure.
for you. I wondered if you have a better idea on the source of this rapid spread. You were talking about looking at the data and the science. I'm wondering if you have an idea of where it's coming from, what's causing it. Also, if we go into a more restrictive tier, is the city in a position to provide further assistance for rental, businesses and loans and such? Also, what's the status on the rapid testing?
Great. So as far as we can tell, I know early on this was all about sectors. What sectors open? What sectors closed? What can we shut down? And how can we stop the spread? And then we got smarter. For instance, as I've pointed out before, construction we never shut down. We just got smart about making sure there was testing and protocol and safety officers, and we didn't have widespread outbreaks on construction sites. We kept those jobs going, the economy going, and we didn't have to shut it down. I know the county right now will be considering tomorrow what the phasing of any future revisions to the current public health orders are and the stay-at-home order. And, the irony about right now is we are approaching our worst numbers with the same things open as we just shortly, a few weeks ago, had our best numbers. So I think we've evolved that it isn't about bringing a cleaver in and shutting all things down, but it is about our behavior. That's why I've emphasized so much these gatherings, the travel, even if it's just driving between cities, counties, or states. We need to stop that gathering for a few weeks to try to get this under control. Cell phone data shows that it's a few places where people are together, and it's not necessarily the fault of the open sectors of the economy. It's the fault of us there. I drove by folks who were outside, eating. Nobody was eating, nobody was sipping. They were 2 feet away from each other, and all their masks were off, as if when you sit at a table, you suddenly don't have to keep wearing a mask. That is our greatest, or our best estimate about how this is spreading is generally there. And it may be that we have to continue making sure capacity is controlled, confined spaces are monitored, and maybe some of the late hours of opening. But I don't see us returning to something unless it gets tremendously bad where we shut down willy-nilly everything in the city. That just wouldn't be that effective, though it remains, I think, the last option, the nuclear button, if you will, in the end for our county health officials. Second, we're already in the lowest tier, so we don't have a lower tier to go to in the state. We're at the greatest risk. We elevated the risk. We're now at the greatest risk, if you want to see that. That's different than your status as a tier, but we're certainly, we feel, in the highest risk moment that we've had. So the state wouldn't necessarily impose anything else. They've already done that with, as I said, more than almost 95% of the state population has now joined us in that tier. And to be clear, we are in red and even yellow in other aspects of the things that they measure. We haven't all been bad news, but one of them, we've remained in the purple tier. In terms of the money, we will do everything we can to help. But the bottom line is no. Without Washington, D.C. stepping up, and this would be a bold and I think an admirable thing for this Congress and this outgoing president to do, to show that this is not political or partisan, this moment, to aid us. If we get more money, we will put that on the street. But to be clear, we are still spending that money. For instance, $50 million is going out just for our utility assistance program in cash that people can use for their utility bills and other household expenses. Our $105 million of rent assistance, the majority of that still will be spent between now and December 31st when it needs to be spent out. And business assistance, similarly, we've been doing about 5 to 10 million a week into that, and that will continue for the next few weeks as well. So we still will be every single day working until there's nothing left in the bank. But if we don't have leadership that replenishes that bank, let's not kid ourselves. And there was a really successful effort in our nation where Democrats and Republicans put down their swords against each other, passed a CARES Act, but that was in March and April, and we've been waiting ever since for them to come together and to get this done. Thanks, Steve. Next question, please. Oh, sorry, and you asked about the rapid testing status. So before the next question, let me answer that one.
Los Angeles Times.
Okay. I'll take this question. Steve, I haven't forgotten about the rapid testing. Go ahead. Good evening.
Hi, Mr. Mayor. Thanks again for chatting with us and taking questions. I have several related questions for you. Can you talk about why you think there's such a problem with infections in the Northeast San Fernando Valley and why testing wasn't in that region earlier? You mentioned increased enforcement efforts the city can do. Can you go into more detail on that, like what kinds of enforcement efforts and what kinds of businesses would be affected? And finally, I know you're hoping to avoid a return to a safer at home order. What do you think of other ideas of imposing stringent rules such as a curfew or limits on business hours, which may be significant given Black Friday is coming?
Sure.
Thanks so much.
Let me go backwards, and let me start by, I forgot the third question Steve had too, which was on rapid testing. The rapid testing pilot is going great. We've finished the first phase of that with our firefighters. We now have some schools that are going to step up and help us, and in the meantime, we've been also using the antigen tests for young Angelenos, so minors who are there, of course, with their parents' permission, getting PCR tests in our testing centers. We're offering both the antigen and PCR tests for them so we can see the impact on our youth. So we expect to have some initial results in the coming weeks. I think the perfect results, as USC said, will be a matter of months, but I hope that there's enough of those results to be able to start looking at the state stockpile of rapid tests and antigen tests and be able to apply that much sooner, maybe even by the end of the year. I've also spoken with Mark Galley, the State Director of Public Health, and they're helping us design some of the testing as we're doing this, the studies rather, and to develop protocols so we know how to use these tests and we know which ones work the best. So going full bore, and the first round was quite successful. For these three things, Northeast, we did have testing, and we've always had testing in the Northeast, to be clear, Hanson Dam and other places. We're adding more to it. We don't know exactly. We've asked public health, and it just seems to be a place where it's a dense area, it's a lower income area. We've seen disproportionately the Latino community. We've seen those numbers be higher. And I'll speak in Spanish in a moment, but for our English-speaking fellow Latinos, I mean, it's important for us. I know we love family, I know we love gathering, but most of the spread is happening from those engagements. And I think that Northeast San Fernando Valley is not immune to that in any way. But we don't have an exact science. We just follow those numbers, and as we've done, whether it was MacArthur Park or whether it was in the African-American community, Native American community, Pacific Islander community, it may be two pre-existing conditions make this even more impactful. People really get those symptoms if they're more vulnerable, and obviously can lead to more deaths. In terms of the enforcement efforts, so we have gaps in certain hours when our business ambassadors are no longer working. So LAPD, which has been a key enforcement partner, can fill that in when we see, a lot of people have complained, what about a bar that we see illegally operating, or somebody doing a gathering in the late hours, gyms, things like that aren't permitted. We'll have the police department involved, our building and safety inspectors, who are part of what's called ACE, the Administrative Code Enforcement or Administrative Citation Enforcement Program. This is like essentially tickets that people give, and a lot of people have asked about that. We do that, with everything from dog collars or dog licenses to other things. We will be using them more as well on enforcement. And then the stay-at-home order. So I think we have to be really precise, and what I've heard the county may be talking about is not a curfew in the sense that we think of a curfew. People can still leave their home and go for a late night jog or whatever. It would be shutting down certain businesses at certain hours. And I do think that, things that are open late, if this continues, that are open past 10 o'clock and where there's alcohol involved, et cetera, those are places we know spread occurs. So those may be places to trim the sails. Again, I'll leave that to the county board of supervisors to make that judgment, but I certainly would be supportive of, if they get advice from Dr. Frere and the county public health officials, that those are some places where we see disproportionate spread. This is not a time when we should be getting together and hanging out in bars with each other, or in late hours where we know that can happen quickly. So I think that's what they're referring to, that some have covered as a quote-unquote curfew. But other than that, I think I hit all the questions. Thank you. I appreciate you. I think we have one more question in English and Spanish.
Yes, sir. The question comes from Gabriel Huerta from Telemundo.
Okay.
Please go ahead.
Hola, Gabriel.
Gracias, alcalde Garceri. La pregunta básicamente es en relación a lo que afirmaron esta mañana en la Junta de Supervisores considerando la posibilidad de ordenar un toque de queda, un curfew, si se continúa el aumento en el número de infecciones en el condado. ¿Usted considera que en la ciudad de Los Ángeles podría tomarse la misma medida? Gracias.
Gracias, Gabriel. I'll say it in English real quick and then in Spanish. Tomorrow, the Board of Supervisors will be considering this, and do we support measures that they would take? Absolutely, I support the idea of there being certain thresholds or certain data that would come in that would cause us to trim hours, look at certain regulations about how many households we can have in our backyards, things like that. We need to control this. This is a matter of life and death. And while the city can be more restrictive, we have really had a great working team, and we try not to be out of compliance or having different rules across different jurisdictions. Both Long Beach, which has its own health department, Pasadena has its own health department, the city of LA is the largest city. Together with the county, we usually act together. So I do support that, and it's a good warning for us. I hope they won't do something instantaneously, but they'll say, look, if the numbers get to here in a few more days, this is the result, and it will be an incentive for us to change our behavior. Sí, yo apoyo, y nosotros en la ciudad de Los Ángeles apoyamos las iniciativas del condado de Los Ángeles a controlar este virus. Es importante tener fechas específicas en el calendario y números, data específica que puedan proveer la gente una meta a prevenir más contagión de este virus. Mañana en el condado considerará estas recomendaciones del Departamento de Salud Pública, y espero que nosotros podamos tener estas metas, porque cuando nosotros podemos cambiar nuestras acciones, nosotros podemos salvar las vidas de nuestras propias familias. So with that, I will now switch over to Spanish. Thank you, everybody. Again, I know it's a tough night and a tough moment, but I know that we will get through this, and I know we will do it together. Please take that advice to heart, and please, these next few weeks, just be extra, extra vigilant in saving lives. Muy buenas tardes, Los Ángeles. Hace 8 meses, cuando empezó este virus, les pedí que hicieran lo necesario para contener la propagación de este virus y evitar un resultado trágico. Y estoy orgulloso del gran esfuerzo y los sacrificios que hicimos todos para evitar lo peor. Yo sé que no fue fácil y que todos estamos agotados. Sin embargo, ahora en este momento no tenemos ninguna alternativa sino de hacerlo otra vez. Esta noche estoy aquí para advertirles que nuestros hospitales se están llenando y este virus está infectando a personas de manera más rápida y en más lugares. Nuestra ciudad está en una situación muy peligrosa. Ahora tenemos que controlar esta propagación. Si no lo logramos, habrán más fallecidos y no tendremos otra opción sino regresar a cerrar la ciudad otra vez. Esta noche les pido que tomen acción. Empezamos con pautas para viajar. El gobernador Newsom el viernes emitió un aviso pidiéndonos a cancelar viajes fuera del estado. Si viajes de regreso a California o si estás recibiendo espuelas, el estado les pide a usted y a sus visitantes de estar en cuarentena durante 14 días. Además, le he pedido a nuestros departamentos ampliar su control sobre negocios y suspender los permisos para los que no están cumpliendo con los protocolos de salud pública. Esto es un momento muy serio y por eso tomamos estos pasos extraordinarios. Nuestro país está logrando nuevos récords de infección cada día y los hospitales se están llenando. Y hoy en día, nuestro país tiene un promedio de una muerte de COVID-19 cada minuto. Hoy el gobernador Newsom anunció que el 94% de la población de California vive en condados que volverán a nivel más restrictivo. Los casos en el condado de Los Ángeles se han duplicado en un mes y tenemos el mayor número de casos diarios desde julio. Hoy en nuestro condado tuvimos 2.795 nuevas infecciones. Entre ellos, 1.245 están en la ciudad de Los Ángeles. Además, nuestra tasa de transmisión subió a 1.03. En los hospitales del condado hay 557 camas disponibles y esta situación es muy preocupante y no hay razón para creer que no se vaya a poner peor. Las buenas noticias sobre las vacunas de Pfizer y Moderna nos traen esperanza para el año nuevo, pero en lo inmediato nosotros tenemos que hacer el trabajo para evitar lo peor. Esto es lo que debe hacer ahora. Primero, quédese en casa cuando sea posible durante las próximas 2 o 3 semanas, saliendo solo para lo esencial. Antes de salir de casa, pregúntese si esta salida es esencial. Si no lo es, quédese en casa. Segundo, debe asumir que todas las personas fuera de su hogar son contagiosas. Lo más importante es no compartir el aire con otros. Esto significa mantener la distancia y siempre usar una mascarilla, por favor. Tercero, no se reúna en grupos. Con el clima más frío, la gente se mueve adentro donde el aire no circula bien y donde no hay luz natural. El virus prospera en estas condiciones. Si es necesario tener una reunión, debe incluir no más de 3 hogares durante no más de 2 horas al aire libre con todos en mascarilla y practicando la distancia social. Esta es una regla para todos. En Maine, el estado de Maine, hubo una boda pequeña que resultó infectando a 175 más personas que no estuvieron a la boda, y con la muerte de 7 personas. Esta es una tragedia y será más tragedias si no controlamos nuestras acciones. Esto puede pasar aquí también, y aunque sea inconveniente, tenemos que proteger a nuestros trabajadores esenciales en nuestros hospitales, supermercados. El Día de Acción de Gracias no es una excusa para ignorar esta regla. El CDC, la Agencia de Salud Pública de los Estados Unidos, ha publicado pautas para esta fiesta, instando a todos a celebrar virtualmente con miembros de su propio hogar. No viaje para visitar a familiares en otras ciudades, ni reciba a otras personas. En los Estados Unidos debemos comenzar una nueva tradición de acción de gracias este año: mantenerse vivo. Además, es importante saber su estatus de enfermedad. Esta noche estoy anunciando una expansión de nuestro programa de pruebas para ayudar a usted y a su familia a protegerse. Durante la próxima semana ampliaremos nuestro programa de pruebas móviles de 3 a 5 unidades en las áreas de mayor necesidad. Y en LAX, el aeropuerto, ofreceremos pruebas con resultados en 24 horas en la terminal internacional de Tom Bradley y en las terminales 2 y 6 para pasajeros y empleados. Además, el lunes 23 de noviembre abriremos un super sitio peatonal en el Valle Noreste. Hay muchos casos en el vecindario del noreste del Valle de San Fernando. Y en este sitio nosotros pueden observar niveles de infección muy, muy altos. Ofrecerá 3,000 pruebas diarias de COVID y gripe, vacunas contra la gripe y pruebas rápidas para personas con síntomas. Es muy importante en estos vecindarios, estas áreas de comunidades, San Fernando, de Pacoima, de Sunland, Tahunga y otros vecindarios en el noreste del Valle de San Fernando, a tomar estas pruebas. Y como siempre, las citas de pruebas están disponibles para cualquiera con o sin síntomas. Para hacer una cita, visite coronavirus.lacity.org/testing o llama al 311. Y se cree que has sido expuesto al coronavirus, hágase la prueba y póngase en cuarentena hasta que reciba un resultado negativo. Hemos sentido demasiado dolor aquí en Los Ángeles con la pérdida de tantos seres queridos. Y es la responsabilidad de todos proteger la vida humana. Es un simple acto de amor. Por favor, hermanos y hermanas, tomen esto en serio, ahora, hoy, y sigan las reglas, y así derrotemos este virus de una vez por todas. Y como siempre, quédense protegidos, quédense en buena salud, y si pueden, quédense en casa. Fuerza y amor, Los Ángeles. Thanks, everybody.